Hey there, welcome back to our channel where we provide you with the latest and most informative content. Today, we will be discussing 5 types of therapy for anxiety that you should consider. If you or someone you know is struggling with anxiety, then this video is perfect for you. Anxiety can be debilitating and impact your daily life, so finding the right therapy can be life-changing. Anxiety affects a significant portion of the population, with over 40 million adults in the United States managing this mental health issue. Sadly, only around 37% receive treatment, highlighting a need for greater education about mental health. Recently, healthcare providers started screening girls and women over the age of 13 for anxiety during wellness checkups, making this topic increasingly relevant. If you're struggling with anxiety, remember that you're not alone and help is available. A range of therapies for anxiety exists, and it's crucial to find the best option for you. Below, we'll discuss some of the most common therapies for anxiety, including cognitive behavioral therapy, exposure therapy, music therapy, group therapy, and dialectical behavioral therapy. Cognitive behavioral therapy, CBT. CBT is popular for treating anxiety and other mental health issues. This type of therapy enables you to understand your negative behaviors and the underlying motivations. By identifying these factors, you can develop healthier coping mechanisms to address anxiety. When experiencing anxiety, a therapist can help you examine how negative thoughts contribute to your anxiety and devise strategies to manage them in the future. Exposure therapy. Exposure therapy is another effective therapy for anxiety, particularly generalized anxiety disorder, GAD. This treatment exposes you to situations or things that trigger your anxiety in a controlled environment, allowing you to confront your fears safely. Exposure therapy has different forms, such as in vivo exposure, imaginal therapy, and virtual reality therapy. In vivo exposure is the most common type of exposure therapy, which involves facing your fears directly. For instance, if you're scared of dogs, a therapist may instruct you to visit a friend with a calm dog. Imaginal therapy requires imagining a triggering situation or item in vivid detail and mentally exploring different scenarios. Virtual reality therapy uses technology to simulate a situation to help patients with anxiety overcome their fears. Music therapy. Music therapy uses evidence-based musical interventions to help individuals overcome a range of mental health issues, including anxiety. The therapy can look different from one person to another, depending on their goals. Typically, music therapy involves listening to and composing songs that relate to the emotions you're experiencing. Music therapy can help reduce blood pressure and stress, boost self-esteem, and develop healthier coping strategies. It's effective for novices and professional musicians alike. Group therapy. Anxiety can often feel isolating, but group therapy can help alleviate negative thoughts by encouraging communication and decreasing feelings of isolation. During group therapy sessions, a therapist moderates the session, encouraging attendees to discuss their feelings and coping mechanisms. Members can lean on each other for support, making them feel less alone. Dialectical behavioral therapy, DBT. DBT is a form of CBT that aims to identify new ways to cope with painful feelings. This type of therapy can help you better tolerate stress, so that anxiety doesn't affect your day-to-day life. By regulating emotions, you can feel more in control of them. Typically, DBT happens in a one-on-one setting, but many therapists combine this treatment with a small group therapy session once a week or so. Remember, anxiety is a treatable condition and you're not alone. Finding the best therapy for you is crucial, and it may take some time to find the right one. You may need to try a few different types of therapy or therapists before finding what works best for you. To learn more about treatment options available in your area, ask family and friends for referrals, request a list of in-network providers from your insurance company, or log on to Psychology Today. We hope you found this video informative and that it has helped you learn more about the types of therapy available for anxiety. If you or someone you know is struggling with anxiety, then please seek professional help. Remember, there is no shame in seeking help, and it can be the first step towards a happier and healthier life.